everyone, I have Michelle Berndt with me from OneShare Health, and we're talking about a very important topic, and that is how can we get coverage in terms of healthcare, not the typical health insurance, because so many Americans out there don't have any type of coverage for their healthcare, or they have premiums they can't afford, they have services that they just can't handle. So, Michelle, thank you so much for joining me today to discuss this important matter.
Hello, thank you for having me.
Absolutely. So OneShare is very unique in terms of this Christian ministry healthcare share, if you will. I want you to describe that, but first let's just start with the basics. We know many Americans don't have any type of healthcare insurance. Many Americans, studies show, are not satisfied with their healthcare insurance. I know when I talk to my patients all the time, they're changing insurances, they can't afford the premiums, they don't like the coverage they get, they don't even know what their plans cover. So there's a lot of confusion out there. Would you agree with that?
Yeah, absolutely. It's very intimidating, really. There's so many options. The price ranges are just skyrocketing still to this day, and there's so many medical questions just to know your options. And we are an affordable alternative. And I think if people really look into healthcare sharing ministries, I know it's a newer concept, they'll really love what they see.
Yeah, so let's talk more about the basics of that. You know, what really is a healthcare share ministry? Maybe some people have heard of the term. I know it's become a lot more popular in the past decade, but tell us a bit more about what they are and how they work.
Yeah, absolutely. So healthcare sharing ministries are just organizations in the United States in which healthcare costs are shared amongst members who have a common ethical or religious beliefs. Now, let me explain kind of how it works. So each month, a portion of the member's contribution, just like what you may know as a premium in traditional insurance, is designated to sharing requests. Now, first, the members will select their provider, and when they go to the doctor or a medical facility, they're going to present their actual ID card, just like normal, and that they'll present at the time of service. Now, behind the scenes, that sharing request is going to be submitted to OneShare, and we're going to determine eligibility, negotiate price, and then finally, we send the payment back directly to the provider. It is the easiest process for a member to go through.
Okay, excellent. So what's your experience? I know you've got a lot of background with, this healthcare share ministry, OneShare. Tell us more about your background, your experience with it.
Yeah, so I am one of the original employees of OneShare Health, and I'm also a member, which I think is very important. I actually used to be the former director of training for OneShare Health, and then recently I became the VP of sales for the affinity market. And so I know these programs inside and out, and I think that's very important as I became a member as well. My entire family is on the Classic Crown program, and just last week my mother even enrolled, and that was a really big decision for us because we are both cancer survivors. And we just were so tired of the high insurance premiums. And when you have a pre-existing condition like that's tough. So we wanted something affordable that we could trust and still had everything we needed.
Yeah, absolutely. So tell us a bit more. What are the kind of viewers out there that would be interested in OneShare? What kind of conditions are you looking to get covered? Is it general family coverage? Tell us a bit more about the details.
Yeah, of course. So some of the highlights that we offer are preventive, including your mammograms, colonoscopies, of course, your general PCP, urgent care, x-rays, labs. We've got surgery, hospitalization, maternity, cancer, telemedicine, which we believe is the wave of the future.
Right.
So much to offer. Those are just to name some of the highlights. We do accept pre-existing conditions. There is a 24-month waiting period for that. So we truly are an ACA exempt healthcare sharing ministry. And I am a firm believer we break every mold. So our programs are affordable, they're flexible, and they're really inclusive. So no matter what kind of avenue you're looking for, is it just yourself, two people, a family, we can accommodate.
Right, yeah, pretty comprehensive. Doesn't seem like there's any categories being missed.
Yep.
So how's it work for people to enroll? You know, some types of healthcare insurance is very confusing. There's certain enrollment periods, and people are used to dealing with Medicare and different insurances. How does it work in terms of enrolling with OneShare? Is it more simple or?
It is. So open enrollment is just around the corner, but with OneShare, our open enrollment is 365 days a year, literally. We also have effective days next day. So you could enroll today and go to the doctor tomorrow. And that's a big deal, you know, with COVID going on and people literally losing their jobs and they can't afford Cobra. Isn't it great to have this option in your back pocket to know that you could enroll today, knowing you just lost your job, you're very stressed out, and you could go to the doctor tomorrow. So we take a lot of pride in that. I mean, you literally could be during the holidays at the dinner table breaking bread with your loved ones, and they ask you, you know, tell me more about this faith-based program, and they could get enrolled that same day.
Yeah, absolutely. That's great. Of course, people are probably wondering, you know, I've had some type of coverage before. I go to a certain hospital, a certain clinic, then I find out later it's out of network. I'm not covered. I get very low coverage. What is OneShare partnered with in terms of a provider network? Because that's really one of the key things people need to know about.
So at OneShare Health, all three of our programs, we offer the Classic, which is the most popular, the Catastrophic, which is the most affordable, and the Complete, which is the most comprehensive. All three of those programs offer in-network and out-of-network sharing services. So that's really important for members to know, especially if you've been seeing the same doctor for 10 years, you don't want to switch doctors. So regardless if their doctor's in network, we still want them to be able to go and get quality health care. Now, we have partnered just recently with First Health Network, and they provide 95% of the US population access to a provider. And so we are very fortunate. We get their full network of providers for all three of our programs. And we actually were the first healthcare sharing ministry friendly contract with First Health. So that was a big win for us. And just to give you a little idea of what they have to offer, they have 5,700 hospitals, over 121,000 ancillary facilities, and over 781,000 professional providers. And that's over 1.5 million healthcare service locations nationwide.
Yeah, that's impressive, no doubt. Very impressive. So I know you guys have a website. People go to foreveronesharehealth.com. So
Yep.
foreveronesharehealth.com, we'll put on the screen. As well, people can call at 833-779-0299. We'll put that on the screen too. But people are probably wondering, what's the best way to navigate? Probably go to the website, check it out, give you guys a call. I know you guys really put a lot of focus on helping people individually when they call up, want to get their questions answered, walk them through the different programs, how it would work, what's covered. It seems like you guys have more of a focus than a lot of companies out there on making sure, kind of hold people's hand to walk them through this very, you know, potentially stressful time for them.
We do. In fact, we have a designated team just for that. It's called OneShare Concierge. I like to call it white glove customer service, but it truly is that. It could be as simple as just, is this the right fit for you? Is it the right program for you? Helping you navigate through a newer concept, which it is for most. So don't let that frighten you. Healthcare sharing ministries are becoming very prominent in the healthcare industry. And so it's really evolved over the years. It's actually a concept that's been around a very, very long time, the sharing mechanism. So with our concierge team, there are four main things they can help you with. They're going to help you actually schedule appointments with doctors. They're going to help you find a quality provider or even medical facility. One of the most important ones is they're going to help you get cost estimates up front for upcoming medical procedures. And that saves everyone involved financially. And then just helping you maximize your resources. For instance, we also offer membership discount programs. And how do I sign up for those? How do I utilize those? And making sure you have everything you need.
Absolutely. So in terms of the sharing part, what kind of things can people get shared in terms of costs? Like walk us through that a bit more, you know, this unique idea of sharing, being a sharing ministry, so to speak.
Yeah, absolutely. So sharing in one another's healthcare and their burdens and their health and their medical needs and wants is such a neat thing, right? And we are a faith-based program. A lot of people don't even know that we have a prayer line. So our pastor is on staff, Pastor Jeremy Farmer. He's amazing. And we even provide prayer for members, producers, and employees. So it's really important that in a time of need, because a lot of times with healthcare, you may have something going on with your body. And so we want to be there for them spiritually, healthcare-wise, whatever we can do to assist. And It's interesting because when I was looking at becoming a member, of course, I knew it was a great company because I'm an employee, but becoming a member is a whole different ballgame. And so I compared a healthcare sharing ministry to traditional insurance. I was trying to find, what does it not offer? And I truly could not find anything. And we have been members for almost 2 years now. So it was really important to me that I could go to the doctor, I could go to the hospital, I could still, have cancer, maternity, because we do have 2 kids, and starting a family it's expensive. And so as long as the baby is conceived after effective date, we even have those maternity sharing services available. So I personally could not find anything it didn't offer, which was a big win.
Right. So you're probably finding a lot of families are signing up for this OneShare in terms of just reducing costs, getting good coverage for all members of the family. Are you seeing a lot of that?
Yes, and due to COVID, there's been an increase in that, but don't wait till open enrollment. You can start looking into healthcare options today, and we would love to assist you with that. And you can just go to the website, forever, OneShareHealth.com, and we would love to help you with that.
Right. And I think you worked something out with the radio show, our Forever Young radio show, right? They call OneShare Health enrollment and talk to one of the specialists, and they can receive, what is it, $50 off their application fee? How does that work?
Yes, so it's a 40% discount for any member that enrolls. Typically, the application fee is $125, but you guys get a $50 discount. So it's a one-time fee of $75. That's it to enroll.
Oh, that's great. Maybe just lastly, so, being in that organization, what's the type of feedback you see on a weekly basis in terms of people that are utilizing the services?
Yeah, so I think it's because, we're still a smaller entity. We have over 50,000 members now, which isn't that small, but in the scheme of things, and they still provide that hands-on customer service. And so if you're trying to read through your membership guide, because when healthcare, those things can be up to 50 pages, and having someone literally, let me show you where to find that answer. Let me show you what that term means. Let me help you find a provider, especially let's say you were just diagnosed with something and you find out you need a surgical procedure. Understanding what you're going through and then trying to find a provider and then a facility and then get it all scheduled and how much is this going to cost me and where do I even start? We are with you every step of the way, not only again with healthcare, but in prayer. So I think just having that team, that family behind you is really what matters. And a lot of times when you sign up with traditional insurance, these are huge carriers and they don't have the opportunity to provide that hands-on service.
Great. Well, thank you, Michelle. Thanks for offering OneShare Health. I mean, millions of Americans need this kind of support, cost-effective, pretty outstanding coverage you guys offer. So again, thanks for letting our viewers know about this.
Yeah, thank you so much for having us. It's just that affordable alternative option to traditional insurance everyone needs to have in their back pocket.
Yeah, and I should let the viewers know we also had an interview with you not too long ago on our radio show, the Forever Young radio show, which is syndicated, listened to on Sirius XM radio as well. And if they go to americasnaturaldoctor.com, they can listen to that interview for even more information.
Yeah, absolutely. We had a lot of fun hanging out. We should do this more often.
Absolutely. Again, thanks again, Michelle, for taking your time today.
Thank you so much.